I've started to really understand the value of creativity in all of our lives, regardless of whether we have the luxury of being called an artist or
Yeah.
not. And so what, in your view, is the importance of
Well,
that?
you're singing my tune here, if I may say it that way, because I quote in this book, there's a great Hungarian-Canadian stress researcher called János Selye, S-E-L-Y-E, and Selye is the one who actually coined the word stress in the sense that we use it today. And he's the one that showed in the laboratory how stress diminishes the immune system and disorganizes the hormones and ulcerates the stomach and all this kind of stuff. But Selye also said, and I quote him here, what is in us must out. What is in us must out. That we all have to follow our creative urges in the way that nature prepared for us. Otherwise, we can be hopelessly hemmed in by frustration. I'm paraphrasing him very closely. So we are created in the image of God. I mean, as you know, whatever your religious views are, but that sense that we're created in the images of God means that we are creators, because the essence of God is creation. In fact, we call God the creator, and we call the result of that creation. If we're created and if we're offshoots of that creative dynamic in the universe, then it means that it's in us to create. And whatever form that takes, I mean, you don't want to see me do art, unless you... I can do a pretty good stick figure, but I'm married to an artist. So that creativity doesn't have to take the form of formal art, but it does have to take some flow of something that's inside you that needs to come out. Otherwise, as Celia says, you get hopelessly hemmed in by frustration. And so in that sense, everybody's got that creative urge, and that may take the form of social intercourse. It might take the form of gardening, I don't care, communing with nature, athletic expression, I don't care what. But there's somebody, everybody's got it. And if people don't realize they have it, it's only because life has hemmed them in and they're too busy. And sometimes they are trying to make a living or trying to survive or too disconnected from themselves. But it's in all of us. And to the extent that we don't give it expression, we suffer. Because let's say I write the book and it's not a success. I mean, okay, big headline in the Sunday Times. Book, not a big success. Like, how big a big deal is that in the history of the universe? But if I identify with the book and it's not going well, then if the book fails, then I'm failing as a person, which then goes back to my very earliest concern about not being worth it, So once I disidentified, once I said, no, this is just a book. It may be a good book, it may be an important book, maybe a book that doesn't hit the mark, but it's only a book. And how it goes says nothing about me or my worth. Once I could decouple that, then I could confidently and much more comfortably go back to the writing of it. But I went through that crisis. I actually said to myself, and I meant it, now I've done the book, that's what matters. I've said what was in me to say. How the world reacts, I can't control. And it doesn't actually matter. On a fundamental level, it's not that I don't want this book to be a success. I mean, success, of course I want it to sell 10 zillion copies, but that doesn't define my self-worth or how I function in the world or how I feel about myself. Honestly, it does not. And I understood that by the time I finished working on it. So once it's done, it's out there doing its work or not doing its work, but I don't have to hang my own sense of self on how the book does. Out in society, what we used to, what we call normal, is also healthy and natural, which is a myth. Because I'm saying that in this society, what we consider to be normal is neither healthy nor natural. In fact, it's hurtful to us. It's a myth to say that what is normal is healthy and natural. That's what I mean by the myth of normal. That's one thing I mean. The other thing I mean is, if we understand that the actual science of the unity of everything, I'm not talking about spiritual insight here, I'm talking about physiological science, that our physiology and psychology is very much affected by our life experiences, beginning in utero, childbirth, early childhood, and throughout the lifetime. It also follows that illness and health are not individual attributes. They're actually manifestations of our relationships and our situation in the world. And our history. That also means when the circumstances are abnormal, you expect people to be sick. Just as if you gave animals something that wasn't healthy for them, they'd be sick. That'd be what you'd expect. So this idea that the people who are ill, either physically or mentally abnormal, I say no. These are normal responses to an abnormal set of circumstances. And rather than being sort of those abnormal ones and then the rest of us, it's really a spectrum that we're all, pretty much all on it. So in those three senses, this idea of normal is a myth. And it's one that keeps us from seeing reality. Is that true about rheumatoid arthritis? Or is it more true to say, as I found out, that this is a condition that shows up in people with certain life experiences and certain ways of functioning in the world? And that because of the science-documented unity of mind and body and the impossibility of separating the activity of our emotional apparatus from, say, our immune system, because it's all one organismic unit. Therefore, when the immune system turns against the body, as it does in rheumatoid arthritis, the immune system actually attacks the body. Is that a thing that's got a life of its own, or is it a process that's happening inside that person because of certain aspects of their lives? Now, if I say it's the thing that happens to you, then that thing has got a life of its own. And that's how most doctors see it. They see somebody with rheumatoid arthritis, they say, okay, this is the kind you've got, this is what's going to happen, this is the only thing we can do, is to mitigate the symptoms. I find that's not true. I find that the rheumatoid, by the way, not just I find it, the science finds it, that rheumatoid arthritis is very much related to stress and trauma. And the more stress there is, the more likely it is to flare up. And if people deal with that stress, if they know how to prevent it, their illness abates. Which means that it's not a thing that's separate, it's a process that happens inside them. There's a whole new science that studies those relationships. It's called psychoneuroimmunology, which studies the interlinked unity of the emotional apparatus of our brain and body with the immune system, with the nervous system, and with the hormonal apparatus. I mean, it's just so obvious. I could change your hormonal state in a split second right now without touching you, just by screaming at you and threatening you. That would necessarily create a change. I mean, it's just clear that our emotions are inseparable. And the other funny thing is, well, several funny things. How do we treat most conditions in medicine, by the way, inflammations? If you go to a dermatologist with inflamed skin, if you go to a rheumatologist with inflamed joints, if you go to a gastroenterologist with inflamed intestines, if you go to a respirologist with inflamed lungs, if you go to a neurologist with inflamed nervous system, as in multiple sclerosis, they're going to give you steroids to settle the inflammation. Now, what are steroids? They are stress hormones. And you would think that as physicians, we would ask ourselves, gosh, we're treating everything with stress hormones. Does stress maybe have something to do with this condition? Now, when you look at the scientific literature, yes, 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 and yes. So there's a great Canadian physician, actually knighted by Queen Victoria, one of the great medical teachers of all kinds, Sir William Osler. And he said in 1890 that rheumatoid arthritis is a stress-driven disease. The French neurologist Jean Martin Charcot, who first described multiple sclerosis, he said, this is a stress-driven condition. And since then, there's been so much research. So what I'm saying is that this way of looking at what we call disease as a process is so much more accurate scientifically, actually, and understanding the mind-body unity. And then, naturally, when people are traumatized, that has a huge impact on their physiology. Their psychological trauma has a huge impact on their physiology. It's just science. But it's science that's not taught to medical doctors. It's just for some strange reason. Well, the average physician never hears a single lecture about, say, trauma and its relationship to illness. And yet there's studies internationally, thousands of them, showing those relationships. So there's this strange gap between science and medical practice. But it would change medical practice for the better. Because what would happen if you went to a physician and you presented with your symptom, and they'd say, okay, look, we'll give you such and such medication to deal with your symptoms, and then let's look at your life. in the context that you live it, and see how that the stresses that you may be taking on, the traumas you may be carrying, might be affecting the physiology of your body. Now, they don't have to be all trauma therapists to do that. They just have to raise the question and to start and to begin the inquiry. That'll make a huge change to that person's life and to their disease process.
How do you define trauma? I know
trauma means a wound. That's the literal meaning of the word. It's a Greek word for wounding. So trauma is a psychological wound that you sustain. And it behaves like a wound. So on the one hand, a wound, if it's very raw, if you touch it, it just really hurts. So if I have a wound around not being wanted, then, or the belief that I'm not, then decades later, if anything reminds me of that, it hurts as much as it did when I originally incurred the wound. So in one sense, trauma is an unhealed wound that touched, we get triggered. That's what triggering means, by the way. Some old wound gets activated or touched. And the other thing that happens to wounds is that they scar over. And scar tissue has certain characteristics. It's thick. It has no nerve endings, so there's no feeling in it. So people traumatized disconnected from their feelings. Scar tissue is rigid. It's not flexible. So we lose kind of response flexibility. So when something happens, we tend to react in typical, stereotypical, predictable, dysfunctional ways because of the rigidity. And scar tissue doesn't grow like healthy flesh. So people who are traumatized tend to be stuck in emotional states that characterized their development when they were traumatized. So when somebody says to you, "Don't be such a baby," it doesn't sound very pleasant, but there's some truth to it. It means that you're probably reacting according to the lines of some wound that you sustained as an infant, and now you're reacting as if that wound was happening all over again. This is what one of my friends in the trauma world, Peter Levine, calls the tyranny of the past. So something happens in the present, and we react as if we're back there in the past when this first happened, and we're not in the present moment at all.